APHF stands for Africa Public Health Foundation. It's a foundation of Africa CDC. As we all know, Africa CDC is the health agency of the African Union. Africa CDC was established to deal with public health issues on the continent. So it's a formation of the African Union by head of states. Actually, at that time, I was one of the first board members of Africa CDC. African Union is basically a conglomerate of African heads of state or African government, if you want. Now, anything that happens have to go through processes. Now, in 2013, 2014, before the formation of Africa CDC, West Africa was ravaged by an outbreak of Ebola. And actually, it's the outbreak of Ebola that sort of accelerated the formation of Africa CDC, and therefore what we have today as a governance sort of structure. So they needed a way to effectively and mostly speedily mobilize funds, disburse funds for program and emergency programs like the one we had of COVID on the continent. So I was approached by the leadership of Africa CDC while I was working in the office of the president. And they asked me if I can work with some diplomats on the continent and some former high-level leadership, like we have former ministers. So we came together, first in Addis Ababa, Ethiopia. We met several people in Nairobi, and the whole process was facilitated by an organization based in Nairobi called Africa Health Business, AHB. I know the head of Africa Health Business, Dr. Amit Taka, and we link up with the former Director General of Africa CDC, Dr. John Nkengasong, and the discussion went on. And we advanced the discussion of the formation of Africa Health Public Foundation, and we officially launched the foundation. So I become the founder of the foundation, and until now I'm the chairperson of the governing council. We are about 7 councillors or members of council. We had 2 additional members who left the council now. It's actually become operational. The council became an operational functioning body of the foundation because we didn't have a secretariat by then. We basically work as if we were the secretariat. We had, instead of 2 meetings a year, we had something like 10 meetings in a year because we were just launched. And then in 2020, as you know, the COVID-19 pandemic hit the world. So we were basically building the ship while we are sailing at the same time. So we had to set up a functional structure, and we had to mobilize resources at the same time. Luckily, we managed in a way. We managed to have a couple of councillors, and now we have a functioning secretariat based in Nairobi. We have staff. We have leads, people like financial mobilization, resource mobilization, communication, human resource. So we're now a functioning organization with actually funds that stream. We donated to many, many countries, especially for COVID testing, COVID vaccine. So we've done a lot of work. And recently we just managed to recruit a substantive Chief Executive Officer for the foundation, and that is a step forward. So we're looking at strengthening the organization in terms of human capacity and support the program, the public health program of Africa CDC on the continent. That is basically the purpose why the foundation was formed. As the chair of the council, obviously, I can only be looking forward with great optimism. We have a great team. We collaborate well. We also wish in the same time actually congratulate the newly appointed Director General of Africa CDC, Dr. John Kaseya, and we look forward to working with him. I know Dr. Kaseya for a while, and I have great hope that we'll reach more milestones under his leadership as Director General of Africa CDC.